OSHIP is the Ohio Senior Health Insurance Information Program. And what we are, we're a state and federally funded program, and our mission is Medicare education and outreach. And we do that a few different ways. We're run through the Ohio Department of Insurance, which is your state agency for anything insurance related, not just for Medicare. So if you're having issues with your auto insurance or life insurance, give us a call. We have experts in those types of insurance that can answer your questions. We're unbiased, we're unpolitical. We're here to tell you how insurance works, how Medicare works, so that you're more educated to make the decision that's best for you. We regulate the insurance industry, so we regulate the agents. We'll talk in a few minutes what they're allowed to do and not allowed to do. If you're talking to an agent and something just doesn't feel right, call us. We'll look into it and we'll see if what they're doing is legal. So we regulate the companies, we regulate the agents, and we're really looking out for you. OSHIP itself has 3 main resources. The first is a 1-800 number. 1-800-686-1578 is our toll-free hotline. So if you think of a question in 2 hours or 2 weeks or 2 years, give us a call. That's what we're here for. Again, we're unbiased. We're here to give you information. We don't sell anything. We're here to make sure you understand how your benefits work, and we can help you find the plan that works best for you, so we don't represent an insurance company. So give us a call. If it's business hours, we have about 8 or 10 people on the phone, depending on the day, who can answer those questions for you. And when you're calling us, you're calling Ohio, you're calling local folks, and we're happy to kind of point you in the right direction. So let us know, especially this fall when you're looking into Medicare Part D plans and Medicare Advantage plans, we can help you with that over the phone as well, and we'll talk about that this afternoon. I'm part of the outreach unit, and I wear a lot of different hats. We do marketing for the program. We're a speakers bureau, which we're doing today. If you're a member of another group and want a speaker, give us a call. We're free of charge. We're happy to come out and talk to any group that wants us to. So we do a lot of church groups, support groups, community groups. Let us know. We'd be happy to come out as our schedule allows. The other part of my job is to train volunteers. And we have about 600 folks all over Ohio who can sit down with you one-on-one in your community and answer questions for you. So here in Franklin County, depending on what area of Columbus and the suburbs that you live in, there's a good chance there's a volunteer that we can hook you up with, depending on where you live. So call our hotline and we can definitely put you in touch with a volunteer who can sit down and meet with you one-on-one. We have a lot of different sites all over the county that coordinate with local volunteers to get your resources. So know that OSHIP is here as a resource. You can call us, you can request a volunteer, and we're happy to make sure that your questions get answered. So what we'll do today, we'll talk a little bit about Medicare. We'll talk about what it is. We'll talk about the options you have on Medicare. We'll talk about what it covers. We'll talk about how to fill in what Medicare doesn't cover, because there are some out-of-pocket costs with Medicare, so we'll talk about how to fill in those amounts that Medicare doesn't cover. Then we'll talk about the drug benefit, and we'll talk about Medicare Advantage plans. On the first page, it talks a little bit about what agents can do and can't do. So we'll just start by saying keep your eyes peeled, and if you think something doesn't sound right when you're talking to a company or talking to an agent, give us a call. So if they're offering you the moon and the stars to sign up for their plan, if it sounds too good to be true, give us a call. They can't give you any cash or gifts over $15. Those kinds of things are sort of red flags. Also, there's been a lot of confusion and unfortunately a lot of fraud with the Affordable Care Act and Medicare. Those two programs do not work together. If you're on Medicare, you're not eligible for an Affordable Care Act product through the healthcare exchange. So it's for two completely separate groups of people, and they don't coordinate at all. So unfortunately, what we're running into is a little fraud. Unfortunately, those scam artists are doing things like calling people and saying they're being issued new Medicare cards. And please verify your number. We'll get you a new card in the mail. So if you get a phone call like that, just give us a call. We've got some phone numbers down here. So there's a picture that talks about sort of the major choice you have to make when you're on Medicare. And we'll spend the rest of our time this afternoon kind of talking about the differences between option 1 and option 2. Medicare's your health insurance. It's for 3 groups of people. 65 and older is the group you kind of think of. If you're under 65, you can get Medicare based on disability or end-stage renal disease, which is kidney failure. So, once you're on Medicare, you have lots of choices. The biggest is, how do I want to get my coverage? And the first is option 1, which is the way most people get their Medicare, which is that red, white, and blue card, Part A and Part B. We'll start off with that, and we'll talk about what it covers. But it doesn't cover everything. There are some out-of-pocket costs with Part A and Part B. So that's option 1, which is 3 pieces. The alternative to that is Medicare Advantage. And those plans take your A and B and D and put it all into one package. So your healthcare, hospital, and drug coverage is all in one package. We'll talk about those plans last. They cover what Medicare covers, they just cover them a little bit differently. All right, we'll talk about applying for Medicare. If you're on a Social Security benefit, before you're Medicare eligible, they sign you up for Part A and Part B automatically. So you shouldn't need to sign up for Part A and Part B if you're on Social Security. If you're not on Social Security for whatever reason, you're still eligible for Medicare at age 65. You just need to sign up on your own through Social Security. And you can contact Social Security, you can do it online, you can give them a call. If you're gonna go in the office, we recommend making an appointment. If you are still working with insurance through that employer, or your spouse is working with insurance through that employer, you can delay your Medicare coverage with no penalty, and you can go ahead and sign up for Part A and Part B when you retire, or that person retires. Most people take Part A because it's free, and then they delay the Part B until they retire. And the reason is, when you're working, your employer generally pays first and before Medicare, so you can just delay the Medicare until you retire. All right, so that is kind of who's eligible for Medicare and how to sign up. Social Security does Part A and Part B enrollment only. That's really their only role in the Medicare process. So don't go to Social Security to ask Medicare questions. They're going to give you an OSHIP brochure and tell you to call us. So we're the Medicare folks. They can do the Part A and Part B enrollment. An easy way to remember what Part A covers is it's your inpatient insurance. When we talk about Part B, that's your outpatient insurance. So Part A covers inpatient hospital. And the way that Part A covers things, it's a little bit different. Part A covers inpatient, so they cover inpatient hospital, short skilled stays in a nursing facility, home health care, and hospice are included under Part A. And Part A works off of what's called a benefit period. And a benefit period starts the first day you're admitted into the hospital. It ends when you've been home from the hospital for 60 days in a row. And the reason it's important to know what a benefit period is, there's a deductible tied to that benefit period, and we'll look at that amount here in a little bit. But just know, if you're discharged and you're home from the hospital more than 60 days, if you're readmitted back into the hospital, say 75 days later, you'd pay another deductible. You're in a new benefit period. And we'll look at that amount in a little bit. So just know you could pay that per hospital admittance. It's not an annual deductible like a lot of insurance. And the important thing with Medicare and hospital is that Part A covers inpatient. I'm admitted into the hospital. More and more often, people are maybe in the hospital overnight. Maybe they have outpatient surgery. They're overnight, but they're not formally admitted. That's all covered under Part B. So that's covered under Medicare. It's just covered differently. So it's really important to know your status. If you're in the hospital, ask those questions. Am I admitted? Am I in observation? Am I considered outpatient or inpatient? Because that can affect how Medicare covers things. They still cover it, they just cover it differently, and we'll look at that here in a little bit. All right, we'll switch gears to Part B. Part B covers your outpatient services. It's kind of a grab bag. If it's not inpatient and not a drug, they're probably throwing it into Part B. So doctors, lab tests, medical equipment, provider services, preventive services, outpatient surgery, outpatient procedures, things like that. So if it's not inpatient, like a room and board charge, and it's not a drug, they're probably throwing it into Part B. Some things that they don't cover, unfortunately, vision and dental are 2 big things that they don't cover, unless it's related to eye diseases or disorders. So they'll cover, checks and screenings for glaucoma and those kinds of things. They'll pay for cataract work, but vision screening and glasses, unfortunately, they don't cover. Fillings and crowns and cleanings and those kinds of things are also not included. So page 8 talks about preventive benefits. We're not going to spend a ton of time on preventive, but Medicare does have a lot of screenings to hopefully catch things before they become a serious problem. Few that I'll point out, one is vaccines. Medicare covers shots a couple different ways. If it's one of the 3 that's on page 8, so flu, pneumonia, or hepatitis B, that's included under Medicare Part B. It's considered preventive. All other vaccines are covered under your drug benefit, so Part D. So the shingles vaccine is covered under your drug benefit. Check with your drug plan and see how they cover it. Also, there are annual wellness exams included under Medicare now. There's one called a new to Medicare physical. In the first 12 months, you're on Part B. That one's fairly comprehensive. Even if you've been on Medicare for years, they will cover once a year a wellness check with your doctor. Not quite as comprehensive, but you can still touch base and make sure you're on the same page. Most of the preventive benefits on this page are free, so there's nothing out of pocket. No deductible, no coinsurance, nothing out of pocket for most of these preventive services. So hopefully that encourages folks to get their routine screenings and catch things before they become a problem. This is for this year what you pay out of pocket if all you have is Medicare. Most people on Part A and B have another insurance that works with Medicare, and we'll talk about those as well. If all you have is Medicare, here's what you'd pay out of pocket. Part A works off of that benefit period. So remember, it's not annual. There's a deductible. Maybe you'd pay it each time you go into the hospital. For this year, it's $1,216 when you're admitted inpatient into the hospital. And what that covers is 60 days inpatient in the hospital within that benefit period. And that can be 60 days at once, or it can be accumulative. So if I'm in for 5 days and I go home, and 2 weeks later I'm readmitted, I'd start on day 6. So they just keep a tally of how long you've been in without having that 60-day break. The first 60 days are covered under your hospital deductible. Days 61 through 90, $304 per day for this year. Beyond that, it's $608 per day. Folks rarely use those anymore. You have to be in the hospital a long amount of time. So the key with Part A is to know that there's that deductible. You could pay that per hospital admittance. It just depends on how long it's been since you've been in the hospital. Those amounts will change for next year. We'll find out probably in the next 6 weeks or so what the amounts are for next year, so we don't quite know yet. Medicare also pays for short-skilled stays in a nursing facility. So if you qualify, the first 20 days are covered in full under that hospital deductible. So there's no additional charge for the first 20 days in a skilled nursing facility. Days 21 through 100, $152 per day for this year. And remember, Medicare would cut off at 100 days in the skilled nursing facility within the same benefit period. Home health and hospice have little or nothing out of pocket, so there's generally not a whole lot of out-of-pocket cost with those two services. Part B is a lot easier. It works like most insurance. There's a premium that you're charged. This year it's $104. So $104.90 is the Part B premium for most people for this year. There are a few ways you may pay more than that $104.90. Most people pay that $104.90. One is if you meet certain income limits, which is over $85,000 a year if you're single, $170 if you're married. If you fall into that category, they basically send you a bill and send you a letter saying you fall into that category, and here's your new premium. That's all handled through Social Security. So if you got a letter, it came from Social Security, check with them. They're the ones that actually do the testing to see who qualifies for that. Also, if you wait to pick up Part B and you're not currently working, or your spouse isn't currently working with insurance through that employer, they will penalize you for waiting to pick up Part B. And the reason is they don't want you to wait until you need it to pick it up. So if everybody waited until they were sick to pick it up, it'd be more expensive for everybody. So they will penalize you 10% per year on top of the current monthly premium for each year you were eligible and didn't have current employer coverage. Now, if you're still working, you don't have to worry about that penalty, or if your spouse is still working, You don't have to worry about that penalty. So we talked about Part A and Part B, and we talked about those out-of-pocket costs. Next, we'll talk about a few ways to fill in what Medicare doesn't cover. One is retirement plans. If you're lucky enough to have access to a retirement plan, check with your retirement plan and see how it works. Generally, they're more comprehensive and they're better than what you can get privately on your own. But on the flip side, they all work just a little bit differently. So you really have to be educated and know how your plan works. Do they tie you to certain doctors? What formula do they use to coordinate with Medicare? All those kinds of things. Also, you may have drug coverage included in your retirement plan. If that's the case, it's probably creditable, which means at least as good as what Medicare can offer you. If that's the case, you can stick with the insurance through your employer. You wouldn't be required to sign up for a drug benefit, and you wouldn't be penalized if something would happen later on, and you'd need to sign up for a drug benefit. If you don't have access to a retirement plan, a lot of people look into what are called Medicare supplements. MedSups, Medigaps, it's all the same name for the same thing. What they are, they're private insurance plans, and they're standardized, which means all companies that sell MedSup sell the same menu of plans. So, whether you go to Mutual of Omaha, United Healthcare, Medical Mutual, they will offer you the exact same menu. It'll be some combination of those 10 plans. So you can really compare apples to apples with these plans. Because that plan, they're all named letters. So that plan F is exactly the same no matter where you go. That plan D is exactly the same no matter where you go. It's just a matter of pricing and customer service. So what we suggest is figure out what benefits you want and then contact 3 to 5 companies and get their current rates. The Ohio Department of Insurance does have a guide on Medicare supplemental insurance. You can give us a call. We're happy to mail those out to anybody that wants one free of charge. The way most of these plans work is if the benefit's included in the chart, it's included in full. So between Medicare and a supplement, there's generally little or nothing left over when you go to the doctor or you go to the hospital. So some people like that it's kind of all-inclusive. You pay that premium and then you're covered in full when you use it. There's also no network of providers. So if you're a snowbird and you're smart enough to get out of here when it gets real cold in about February and go to Florida or Arizona or wherever you're going, this plan will move with you. You can use any doctor nationwide. So if you're traveling and you're not in the same spot all the time, a Medicare supplement's sometimes good to look at. When we're looking at pricing, they tend to be fairly expensive. So on top of Part B, you're looking at maybe an extra $150, $200 per person per month. All these plans are individual. But when you go to use it, you're covered in full. So they're also good for people that use a lot of healthcare services because you pay that premium to be covered in full. So they're good for people that travel, that don't want to be tied down to a network. They're good for people who want to use a variety of healthcare systems for the same reason. So if you want to go to Ohio State and Mount Carmel and Ohio Health, a supplement will let you do that. Also, they're good for people who use a lot of services because you pay that one fee and you're covered in full when you use it. Whether you go to the doctor once in a month or you have $10,000 worth of services, it's the exact same amount. They're also good for people that want to know exactly what they're going to spend every single month, that like that consistent cost. We'll talk about Advantage plans later. Those work just the opposite. If you want to look at a Medicare supplement, the best time to do it is when you're in one of your guaranteed situations, which is at the bottom of page 10. First is when you're new to Medicare. The first 6 months that you're on Part B and 65 or older, you can go to any insurance company. They won't ask you health questions. They can't raise your rates or deny you based on health. Outside of that, the companies can generally ask whatever health questions they want. So you can try any time throughout the year, but they can ask health questions, they can raise rates, they can deny you based on health. Also, if you ever lose your insurance and it's not your fault, like your retirement plan goes away, at that point you can get a MedSup with no health questions. You generally have a 2-month window to make whatever changes you want with no health questions. Doesn't matter what time of the year it is. So if you ever lose your coverage, Medicare doesn't leave you hanging. They do give you a 2-month opportunity to make whatever changes you want. The next few minutes we'll talk about Part D, and we'll talk about who can help you compare plans, how to compare plans, what to look at when you compare plans. So the way Medicare Part D works, it's the drug benefit. There are 2 different ways to get Part D coverage. One is what's called a standalone drug plan, which is I have Medicare, I have another insurance, probably a supplement, I'm just looking for Part D. I'm looking for drugs only. You can get what's called a standalone drug plan. Or if you're looking at Medicare Advantage plans, those generally offer Part D as part of the package. So it's the same coverage, it's just, is it standalone or is it bundled into the rest of my health care? Remember, if you have employer coverage that covers drugs, it's important to know how your plan stacks up to Medicare. Because if it's better, you can stick with what you have. So always check with your employer. They'll send you a comparison in the next month of how your coverage stacks up to Medicare. So make sure that you read any mail that comes from your employer. If you want help comparing plans this fall, Medicare.gov is the best place to do it. And we know a lot of people don't use the computer, and that's fine. We'll use the computer for you. You kind of look at 3 different things with these plans, which are coverage, convenience, and cost, which is basically what pharmacy do I want to use, which there's a place on there to put your pharmacy. If you want to use mail order, we can sort by mail order. You don't have to use mail order. So what pharmacy do I want to use? Are my drugs covered? All these plans have a different formulary or different list of what they cover. And then cost, what's it going to cost me? Because all these plans cover different drugs at different pharmacies at different prices. So Medicare.gov can take those 3 things and match it up to the list of drugs you take and give us pretty much to the dollar what it would cost for you based on the drugs that you take. So it really gives us a good idea of what it would cost for you. And we can do that free of charge. Again, we don't care what company you go with. Give us a call. Or we can hook you up with a local volunteer if you want to do it one-on-one. We can hook you up with a local volunteer in your community. So we have that available as well. If anybody's over on the east side, we've got Ann Coons in the back. She's got counseling out at Wexner Heritage Village. And there are several other locations all over Franklin County that can do it with you in person. So on page 14 is how these plans are structured for next year. And these plans do have monthly premiums. The average premium is about $30, so there is a monthly fee. From there, they keep a tally of how expensive your drugs are, and you jump into different levels based on how expensive your drugs are. So you could have a deductible. Next year, the highest it is $320, so you could pay the first $320 in drug costs. Some plans have one, some don't. Once you meet your deductible, if you have one, the plan kicks in. And you start paying copays. So you start paying copays or a dollar amount, the plan picks up the remainder of your costs. And that cost shares in place up to $2,960 in total drug costs. You pay a portion, they pick up the remainder. They pay along with you until you reach $2,960 in drug costs. At that point, the plan cuts off and you're in what's called the donut hole. They pick back up when you've paid $4,700 yourself out of pocket that calendar year. So they pay, they stop, and then they pick back up. Medicare.gov will let us know exactly where you fall along the spectrum. A lot of people don't get near the donut hole, so it really depends on what you take. Medicare.gov will show us what it would cost, what month you meet all these milestones, and add it all up for us at the bottom. It'll even show us pharmacy to pharmacy, what it would cost at different pharmacies, so it makes it really easy to compare. If you get out of the donut hole, you're covered pretty much in full, 95% or better, depending on your medication. There is some help when the plan cuts off. There's a 55% discount on brand name drugs and a 35% discount on generics once you get into the donut hole. So even though you're paying a little bit more, there are some discounts in the donut hole. So again, each plan's just a little bit different. It's about matching up your drugs with a drug plan. All right, so that's Part A and B, Medicare supplements and Medicare Part D. Last thing we have to go over is Medicare Advantage. And the way those plans work is they combine those 3 things into one package. So you're getting your health care, hospitalization, and drug coverage all in one package. Instead of getting it through Medicare, you're getting it through an insurance company that's contracted with Medicare to offer you the benefit. So they cover what Medicare covers, they just cover them a little bit differently. So to be eligible, you have to be on both Part A and Part B, and you have to live within the plan's service area, which is the county. So if you live here in Franklin County, you've got about 20 choices. If you came in from Delaware or Madison or Licking or somewhere else, you may have a different list based on where you live. One advantage to Advantage is they don't ask health questions. The only health question they'll ask you is if you have kidney failure. If the answer is no, they'll take you same rate as anybody else. So if you're under 65, supplements can be tough to get if you're on Medicare due to disability. Advantage plans will take you, so they'll take anybody. Again, they're alternatives to original Medicare. One way these are different is most of them are HMOs and PPOs, which means they've got a list of doctors you need to stick to. With an HMO, you have to use their doctors. And the example I always use in Franklin County is Medigold. Not to say it's good or bad, but Medigold's a Mount Carmel product. Can you go to Ohio State with a Mount Carmel product? No. So you have to make sure you stick to their providers. Some people are okay with that, some people aren't. It just depends. Also, with a Medicare HMO, that is your only insurance. Medicare will not come back in and pay the claim if you don't go to a networked provider. So unless it's an emergency, you have to use their doctors. With a PPO, they prefer you use their doctors. The plan pays more if you do. You can go off the list, you'll just pay more out of pocket yourself. Most plans include Part D. If it's part of the package, you have to take it. You can't add an extra Part D plan. So some people like that these are all in one package. Everything's all kind of bundled into one package. The big difference between Medicare with a supplement and Medicare Advantage is how those the payments work. With Medicare and a supplement, we said you have that pretty big premium on top of Part B, but you're covered in full when you use it, and you can use any doctor you want. Medicare Advantage works just the opposite. You still pay for Part B, so you have that $104.90. From there, your plan may or may not have a premium. If it does, it's usually less. Maybe it's $35 a month, maybe $75 a month. But they assign copays to every service they cover, and you pay those copays when you use it. So you might pay $20 at the doctor, maybe $40 to see a specialist, maybe $200 a day in the hospital. Sometimes you pay less than you would have paid under Medicare. Sometimes you pay more. So it's really the more you use it, the more you pay out of pocket. The less you use it, the less you pay out of pocket. So these tend to be popular with people that are fairly healthy because you don't have that big upfront premium, but you pay as you use it. So just be aware if you get a Medicare Advantage plan, how much those costs would be if you have a hospitalization or need to go to the doctor, which Medicare.gov can compare theirs for you as well. So if we're helping you compare, just check, do I want Part D or Medicare Advantage? And we can go ahead and get you the drug costs and the health costs on a Medicare Advantage plan. The last couple things we have to talk about are some lower income programs that may fill in some or all of these amounts that we've been talking about all along. Medicare savings programs, those pay your Part B premium for you. So if your income and resources are below the levels, give us a call, we can get you the application, you get free Part B. They put that Part B premium back into your check. Page 19 talks about what's called the low-income subsidy or extra help. This works with your Part D plan, so this will pay your drug costs. And if you're eligible, they pay all or most of your monthly premium, all or most of your deductible, and you pay less per prescription. So a lot of people just pay up to about $7 per prescription, and that's it. No premium, no deductible. So if you think you might qualify, give us a call. Single person with under $1,458 per month. Married couple, $1,966. With liquid resources, less than $13,440 if you're single, $26,860 if you're married. So if you think you may qualify, give us a call. The application's on Social Security's website. It's a really easy application. We're happy to help anybody fill it out over the phone. Also, if you don't qualify, you might know somebody that does, maybe a neighbor or a friend. Have them call us. We can help them look into it. And it doesn't hurt anything to check, so it's not going to hurt credit or anything like that. So that is sort of your Medicare overview. You can call us at OSHIP. If you're tech savvy, our website has a lot of the same information that we talked about today. 1-800-Medicare is available 24 hours a day. If you think you've seen any fraud on a provider end, on an agent, give us a call. Call Pro Seniors. So lots of good handy phone numbers. Thank you guys so much.